everyone at home. How are you guys doing? Good evening, everybody. How are you? My name is still remain Murphy Ojo, and welcome to my channel. You're welcome to my program, the usual program, which is Bits and Pieces with Murphy Ojo. Yeah, what do we have today? What we have is not much. I've discussed most of the topic in most of my programs. One way or the other, I always mention it because they're very important. And what is that topic? Because I don't want to waste everybody's time. Last week I wasn't here. I wasn't here for a reason, because everything was giving me a bit of issue, the system, everything. So I then said I should leave it for today. Sorry for everybody who have been waiting. But here we are this week, and on a good Monday. How was your Monday? My own Monday was, it was good, very lovely. And how are you guys? My care out there, how are you guys doing? And thank you very much for the good job you guys are doing. Just continue to keep the flag flying and don't disappoint. You know what I mean? So as I said, what's the topic we're going to discuss today? The topic we're going to discuss today is nothing more than duty of care. I've already mentioned it several times because it's an important part of the job. Very important. Sometimes we really overlook it. And then, what is duty of care? Duty of care is, we can call it morally and legal obligations unto every health practitioners in this country, United Kingdom, that your action or inaction will not result into any bad thing. And we all owe each other and one another what? A duty of care. Gone are the days when you could walk into your client's house and then follow your support plan or your care plan. You could follow your support plan without even caring about what surrounded your service or what is going on around them. But things just change, because sometimes our inaction could lead into something fatal, and our action sometimes could stop something fatal. So when I'm talking about duty of care, where I want to narrow it down for today's program is about some of my carers or some of the carers going to a client's house and they feel that, clients who are order that the whole house is full of loads, it's not your problem. You are not there to clean. Fine. And for those people who feel that I only need to look after my clients, nothing concerns me with their family member, even when they are dying, you don't really give a damn. That side too. What I want you to know, let me start from the second one. When you are going on the streets, everywhere in the United Kingdom, and somebody had a fall, in this country, we all owe each other a duty of care. The minimum you could do is to pick up your phone and to call an ambulance. You could walk away. You could walk away because there's no obligation on you. You are not obligatory to call anybody or to, you could walk away. But if they want to know what really happened and you are picked on the camera or on the CCTV, there's possibility they might want to speak to you. That is where the issue might come from. But when you now take up the responsibility of, as a carer, you've already accepted the rota. By accepting the rota, what you're doing is you're taking the responsibility over that rota, over that particular period. That, you'll be looking after this person within this allocated hour or allocated minutes. But whatever happened to that person in between that time, you're going to be responsible. But mind you, let's say they're living with somebody and you go in there, you find that person being sick or unable to do anything or struggling to even stand up or to do anything. But your own is that, okay, I'm not here for him or her. I'm actually here for my own clients. If anything happens to that person, you'll be liable. That person happens to be a member of the public. And wherever you find yourself around a member of the public who is sick, the onus now fell on you to do something. Imagine that is a confined area. You've gone to your client's house, you've attended to your clients, and you see maybe the wife, the husband, the children, they're not feeling good. It is your responsibility to step in and at least make sure that, okay, you do something. You do something. Try to get to the bottom. At least, are they able to talk? Are they able to sleep? Are they able to respond to whatever? You go into a client's house, their family member, though they are good, but because they are not in good frame of mind or perfect frame of mind, they might not know what is going on around them. But you that come down to look after them, always ask questions. Where is your wife? Where's your husband? Where's your son? Where's this? Because you've used to seeing this person around that service user. And suddenly they might just be inside there. Something is wrong with them. It's your responsibility. You've got no right. You've got no right to leave that person. At least tap them, talk to them. There are a lot of people you'll be talking to, you'll be tapping, you'll be shouting at, and they won't be able to respond. Just do the minimum. And what is the minimum? So call the ambulance. I always advise you guys, please forget about I'm losing my hour. It's all about money. That money will not count when the issues arises from you not doing what you're supposed to be doing. That money will not count. It will be something totally different that will count. What we count is your training. What we count is people telling you, okay, who was there? Or did they notice anybody? So far they realized that, okay, one of the occupant of that residence have got a carer. Yeah, carer been here today. Yeah, which is yes. You would then be able to tell them, what did you see? Even if you tell them you did not see them, but do you usually come down there? All different kind of questions with them arises. I want you guys just to watch that line. It's very, very important. Because what they wanted to link that thing to, your inactivity to, is a negligence. So far they're able to establish a negligence around that thing, police could be calling. And when you started to face scrutiny, investigation based on you just do the minimum, the little side of the other thing. Nobody is saying that you have to carry that person. Nobody is saying that you have to give that person a care. Nobody is saying that you must take that person to the hospital. Do the minimum. Call the ambulance. Let them come down. This person can't breathe anymore. This person is more or less lifeless person. Let them come in. You have lots of time ahead of you to continue with your job. Just call your offices. Something else is happening here. I need to do the right thing. Even someone should be able to advise you. Somebody who knows what they should be doing should be able to advise you not to leave, to stay there. But what I want you to know is not everybody that know what they have to do. It is not everybody. It is not everybody. There are a lot of caregivers that are they just have the money to establish, to have a care company. Most of them don't know all these little things that they've got to do. Even your own clients, you will see some of your managers that will ask you, just go to wherever you're going, go and do whatever. But please, don't go. Always make sure you see the bottom of anything. Call the ambulance. When they arrive, tell them what you've seen, and then you get away. And when you are writing your own report, you write it as part of your own report. You write it as part of it because you don't know what to end that person. It's very, very important. Please, the time where, okay, I do things according to my care plan, according to my support plan, has already gone. Yes, you've done everything in your support plan. but there are family members who are struggling one way or the other. There are family members who are unable to breathe. There are family members who are on the verge of death. You don't know. You've been there every time. That is not how they feel. Sometimes they will tell you, so far you tap them, you touch them, you talk to them, and they said, I'm all right, I'm just being sick, I'll be fine. Yeah, they've been able to explain things to you. Then you can go. But you write, this is a condition you made this person, but it's not do or that kind of condition. And then you spoke to him or her, and this is what they said. That is why you decided to leave. Because you believe that, okay, it's just more or less being sick. And that's all. It's not for you to make any judgment that, okay, but so far you are able to do certain things. You could work, you would have spoken to them, but report it. Detail it in your report and go away. But when you sit there, when you tap somebody, when you push somebody, when you talk to somebody, when you shout, and they couldn't answer, they're struggling or they're slurring their word, please do the needful. Do the needful, call the right person. As I said, I will come from the second. That's the second one. The first one is when you're looking after a particular client and the condition of the house is not good. The condition of the house is something that you yourself, you couldn't even live in there. Nobody is telling you to do it. Nobody is asking you to clean. Nobody asking you to be the one that will show that responsibility. The only responsibility they want you to show at this point in time is for you to raise the alarm. To raise the alarm. Because if anything happens to them as a result of them living in that kind of a condition, you're going to be liable. You're going to be liable. It's about tricky thing that you believe that, okay, but you've done your job. Yeah, you've done your job. But are they living in a very good condition? The condition that you feel a human being should be living in, even nobody, even an animal. So you've got to do more than what is written there as part of your job. You've got to go extra mile a bit. Be caring for them. That is what I said. We owe each other a duty of care in this country. If I see you slumped on the road, I won't walk past you. I've got to do the minimum, and that is the minimum is just to call the ambulance. I'm not going to, if I'm trained well CPR and I realize that, okay, maybe it's heart failure kind of a thing, yes, I could put my skill into use. But if I am not, the minimum that I could do is just to make sure that I call the ambulance. I call somebody, I raise the alarm. I wouldn't know. Anybody might be around that will be able to do the CPR without any issues. Yes, I need to just go raise the alarm, do something. I just can't just leave you and then walk away from you. It is not allowed. It's a sort of, as I said, it's a moral and legal obligation. If it is, I'm not taking the responsibility to look after you. I just see you on the road. No, having maybe a seizure or anything. Yeah, that is a moral side of it. It's my responsibility to call this, but I could also walk away. But morally, is that right? That's actually wrong. Because today is that person, tomorrow might be me, might be you. So that is why you've got to the, and the legal side of it is when you've already taken the responsibility of going to that place, of looking after particular services out, or service of client or patient, whichever that you are calling it. It is now your responsibility to do what you've got to do the right thing. And what is that the right thing? To make sure that all those things that you believe that, okay, it shouldn't be, to raise the alarm and to find a way to resolve it. And as you know, that could lead to you guys reporting it and then whistleblowing. If you know the stages of reporting, you report to your client. Let's say the whole house is full of rubbish. You tell your manager or your supervisor, this is what is going on. That house is not habitable. No human being should be living in that house. Then you'll be able to say, oh, you don't know what? Something needs to be done. When you report it and your managers they do nothing to it to change the situation, You go back to them, and then you raise it. You make your feelings known to them. This is going on. This shouldn't be. Other stuff. At the end of the day, I bet you, no manager will. Yeah, there are 1 out of 1 million of them that will take their eye away. But I really say somebody will take their eye away. Yeah, we might be thinking that, okay, people are all about money in this field. Yes, but I really say a manager will take their eye away, because that one will lead to safeguarding all the stuff. But if they refuse to do that, they do nothing. You as good as go as far as your social services, security, even the police. But don't let us get to that side. Let us just stay in between our duty of how we owe the client that we are looking after a duty of care. I started an example to you one time when there was this case about a lady who usually go to a client's house. She was actually looking after this man perfectly well, but she was not responsible for the cleaning side of the whole thing. Even when she was not responsible, she was doing the bit that she could do. The friend happened to be the one that is responsible, and in between that time, the friend got sick and then went to the hospital for cancer. The friend died, but the friend daughter started stepping and was doing what she should be doing, but not to a larger extent. It was just doing bits and pieces. Suddenly, the mom pressed the alarm bell because he's got dementia. Pressed the alarm, pendant alarm. Police came in several times. Police said, okay, they've reported several times the condition of the house. That things should be improved. One way or the other, social services didn't pick it up. Nobody picked it up. But one night, the same thing happened. Police went in there and they realized that there was a smell. They opened the oven and they saw a rotten food. Mind you, the carer are not there to cook. She has never, for almost a year she was working, she has never for one day opened that oven, because she has nothing to do with oven. How a rotten food of almost a year was there, I wouldn't even know. So she has never been there to cook. It has been a microwave meal that the lady has been preparing. But what they were trying to establish is that, okay, still, if you don't even cook, you ought to have raised this alarm that this place is not habitable. But usually, if you've worked very well in social work care, you know what I mean. There are a lot of people that they just want their house to be like that. But you've got to just report it. Report it. Let them report it to social services. By the time they escalated it to social services, to whoever that commissioned the whole thing, they'll be able to now get to the situation that, okay, even when police comes down to you, okay, we've done this, we've done this, we've done this, we've done this. So before that, by the time they're trying to push you to the wall, why didn't you just go as far back as the police? But provided the social services are still, or whoever commissioning are still finding a way to handle the situation, I don't think you will only be culpable. There are a lot of people that will be culpable for that thing. I don't even see them even go as far as doing anything for you. I bet you, so far the whole thing comes to their end, it's either they just feel safeguard and they end it that way. It is when they feel that, okay, they're on top of the whole thing, or the bulk of the whole thing actually comes from your end. That is when they escalate it. It's sometimes you feel that there's no justice in the system. And that is how it feels sometimes to me too. But let's just do what we've got to do before we get to that end of saying that, okay, because why me? Why not this person? Why not that person? Why not that one? You just do what you've got to do. Do the right thing. Report things where you need to report it. When you see a little thing, just finding a way to report it. Sometimes you go to your client's house, you meet somebody there. You don't even document it that you met somebody there. What if the person that came actually did something to your client? What will you do? You'll not be saying that you ask for them, we ask for whom they are, their names, everything, and then put it down in your documentation. So if anything happen in future or later on, you'll be able to refer back to that thing. Okay, this is what I saw, this is what happened, and I document it. When I got there, I met somebody that he or she said, okay, it's my uncle, it's my cousin, or it's my aunt, it's my niece, it's my whoever. So you'll be able to then show to them, this is this. I don't always like to scare people in this field, but I always like to set the record straight. Yeah, there are loads of opportunity, and now that you guys are coming all over the world to do this job, please just don't look away from all these little things. Those are these little things that are causing a lot of issues. Focus on what you are doing. Make sure that you know what you've got to do, when you've got to report things. Learn, get to know your stuff, get to know your job. I've had people saying that, okay, this job is about wiping a bomb. It's gone beyond wiping a bomb. Yes. I was telling some people, some of my carers, that the difference between them and the nurses is that nurses inject, you guys don't inject. But you've got to know everything around you. And you in domiciliary care setup, don't compare yourself with people from a home residential setup. You've got to handle everything. Medication, most of them don't even know how to handle medication, except those who have worked in domiciliary setup before. They still have to pass through a lot of things because of level 3. But you guys, you have to do everything. From day one, you've got to be trained on how to administer medication. You've got to know the name of the medication. You've got to know why they prescribe that medication. You've got to know the adverse effect of medication. And you've got to know what you have to do when you notice any one of the adverse effects. So now tell me, what's the difference? Yeah, you don't dress pressure sore, but sometimes you apply cream to pressure sore. Whenever you see pressure sore, you raise alarm, you draw, you mark the diagram. You do a lot of things, a lot of jobs. That's what you do. That is what they call know-how. That's what they call, okay, you know your stuff. But knowing that thing is not enough without you not getting to know what you've got to do next. Your reporting, most of you guys, your reporting skills is still very low, very, very low. You guys just decide to keep a lot of things to yourself. It is when issue arises, you'll not be hearing a lot of things, loads of things. But why do you have to wait till when issue arises? Why do you have to wait till when you have issues? So, I don't always want to use the word out, but I like to use the word I'm begging. I don't want issues for anybody. I don't want issues for anybody, anyone. I'm begging you guys, just do the right thing. Do the needful. Do the right thing. Do what you have to do to make sure that, okay, it is not you receive a call from your office and, is there anything that happened? But when you've done what you have to do, even if they call you 12 o'clock, 12 midnight, 1 a.m., you'll be bold enough to say whatever. You'll be bold enough to tell them, okay, this is what I've done, this is what I've done, this is what I've done, this is what I've done. There is always this popular word, this popular phrase, cover your back. Cover your back. And when you see your colleague doing the same thing, please talk to your colleague. But when you see that, okay, there's going to be a sort of friction, report to your office. Reports to your manager, reports to your supervisor, report to your coordinator. They'll be able to know how to handle it. Because sometimes when you inform somebody, there are different kinds of people. There are a lot of people that, okay, yeah, I get it, how we change from. I don't think this is how we should be doing it. I believe this is how we should do it. So when there is a sort of friction, just take a step back. You don't, okay, and then report it to the right person. And they will handle it. They will handle it. Don't allow anybody to bully you into not saying what you have to say. Because this kind of people that always give you a sort of bully atmosphere, they are the same set of people that will come when the issue arises, that will take a step back, even trying to throw you into the hellfire. It's not me, it's him or she's the one. So I will not take much of your time tonight. As I said, we all owe each other a duty of care. Do the right thing. make sure that whatever that happens to your client, if you see you are attending to a client whereby you go to the house and the house is so dirty, please report it. And I will tell you there are some other clients too that, okay, you go into their house, they've got no heating, I mean gas. Do you know what most of them usually does? They usually use their normal cooking gas they will just switch it on. That kind of a thing, don't just overlook it, because the house could get burned down and they could die in the house. You notice that kind of a thing, just flag it off immediately. Hello? Hello? Okay, please guys, make sure you do the right thing. And the right thing is just to make sure that you report what you need to report. You don't overlook anything. Don't overlook anything. Just report it. Okay? I will leave you this evening until next week, when I'll be coming with another topic. Hopefully it will be a very, very lovely one. And guys, don't do what I won't do. What is that I won't do? I won't leave my care clients without looking after them, because I owe them what? I owe them